Toward the end of 2021, the American Academy of Pediatrics declared a national emergency for children's mental health. They said the problem existed before the pandemic, but the challenges with COVID-19 have worsened the crisis. So what can we do in this new year to help improve children's mental health? I talked to Dr. Jen Layton Armacon, who is a licensed clinical psychologist, for some suggestions. Let's jump right into the conversation.
The story was bad prior to the pandemic in terms of the state of the mental health of children and adolescents in our country. The numbers were getting worse. And then when the pandemic hit, we see an exacerbation of those already existing issues. And that is especially the case for young people and people of color. And so it's an important call to action on a policy level across institutions and really in our families and our communities.
Yeah, and it seems like the age range, it's not just teenagers, it goes down to 5 years old. How do we solve this? Can we solve this, or what is it going to take?
Yeah. I think a culture shift is urgent, and that culture shift is sort of away from making sure we have this sort of perfect words or the exact sort of conversations that we tiptoe around like I'm doing right now, sort of feeling anxious about the topic, and move towards more openness, focusing first and foremost on slowing ourselves down as parents, as providers, neighbors, adults, in order to steady ourselves and make space for children to feel our energetic presence, to be trusted adults. That's the primary protective factor, is for children to have trusted adults that they can talk to.
Yeah, and I know you've mentioned that, somebody needs to be there to listen to them, to be that supportive person in their life. Can it be just a small change though, or is this going to take something more radical?
It's more radical. So we need both. We need a combination of the structural changes, the relief. When we see the numbers as they are in emergency departments, 5 to 11-year-olds showing up in emergency rooms increased 25%. Girls suicide attempts, increasing 50% when looking at the data from 2019 to 2021. There is that urgency, right? And there's the more daily mindfulness around these issues. Talking about these issues is really important, right? Talking about how we're feeling, talking about issues around inclusion is really important, right? How do we make spaces that marginalized people, that all of us feel safe and feel free to be ourselves?
There's also an organization that she suggests to turn to for help. It's called Our Minds Matter, and it's a program here in DMV schools. You might remember we actually highlighted them on our Road to a Better Community series. So you can find that story at WUSA9.com/bettercommunity.